Welcome to the MUGHUB podcast, the ultimate platform for all things related to medicine's use, patient care, and the incredible world of pharmacy. We are your hosts, Connor and Sian, and we're thrilled to have you join us today.
Here at the MUGHUB podcast, we're passionate about empowering future pharmacists, expanding your knowledge and igniting your curiosity. Whether you're a first year embarking on your pharmacy journey or a final year getting ready to go out into practice, this podcast is designed just for you.
Across our series, we delve into 4 captivating themes that will take you on an enlightening and entertaining journey. From exploring intriguing clinical topics to showcasing the extraordinary individuals who make up our incredible teams, we're here to unlock the secrets of the pharmacy world.
So grab your favourite mug, settle in, and let's embark on an incredible voyage together. Get ready to be inspired, educated, and motivated as we unlock the vast potential of pharmacy and the vital role it plays in healthcare. Well, today we're very lucky to have Dr Greg Scutt with us, who was instrumental in putting together the new degree for pharmacy at Brighton. And welcome, Greg.
Thank you, Sian. Thank you, Connor, for having me.
Oh, you're so
very
welcome.
excited.
Are you?
Yes.
What are you most excited about?
What's talking to you today?
Yeah.
Well, this whole experience, spending an hour with you is...
No one said an hour.
That feels like a very long time, though.
For that time.
Sort of 2 hours.
Well, let's just see how we go, shall we? So I would like to talk about the new degree, but before we do that, I was wondering if you could just talk to us about how you got into pharmacy.
How I got into pharmacy? Well, that was a long time ago, Sian. And I did have to have a little think about this, but it was, I guess, during my A-levels, I enjoyed all the sciences and things like that. And I don't want to use the cliche of, patient care and things, but I do remember experiences at school where we went and visited old people's homes and things like that. And those really, captured your imagination about wanting to help people and those sorts of things. But really, I guess the world of pharmacy, I became aware of it when I played cricket. And a couple of the guys I played cricket with were hospital pharmacists.
Okay, I was struggling to find the link.
The link, yeah. Well, I had to bring cricket into it somehow.
Yeah.
I already know the link because I've met one of these people
met one of them.
at a conference. Yes, so
yeah, so that must have been Steve Williams.
Yes, it was.
Who I'm still in contact with. But there was also a chap there who was a paediatrician. So he was a medical doctor, and what I seem to remember is the guy who was the medical doctor had to miss lots of Saturdays. Because he was on call a lot. Whereas the 2 pharmacists only missed a few Saturdays.
Right.
So at the time, cricket was a real passion, and I thought, if I want to do a job, I want to play as much cricket as possible.
Fair enough.
So I arranged to go and visit these 2 pharmacists on there. Well, they were both hospital pharmacists in their jobs, and it was a really illuminating experience. Mm-hmm. The input that they had into patient care, the knowledge that they had was interesting. So it seemed like a nice profession, interesting profession to get into. So that's really where it all started.
Love it. Okay, so yeah, an enthusiasm for science combined with a dislike for working at the weekends and patient care.
There was some working at the weekends,
I'm sure
there was some working at the weekends, but it wasn't as much.
Okay.
Yeah.
Good, thank you.
I don't know if that's the same anymore, but
The not working
at weekends. I'm
know.
pretty sure
Right, yes.
pharmacy teams work a lot more. So we've
probably do
7-day working in most hospital trusts now. So
Yeah, I would imagine that's changed. Would you still go into it again?
Yeah, absolutely. Because especially now, because cricket is not really a passion anymore. Well, physically, it's not very easy to do anymore. So, working on a Saturday is a lot easier.
oh yeah, definitely.
I can see that.
So for our listeners, just maybe if you could give us a little bit of an overview of what your role here is at the university.
Yeah, well, I guess it's in a sense, a traditional academic role in that, we have our core job of teaching and doing research, which are the 2 big passions. And then alongside that at the moment, I lead up the medicines use team, which is the team we have all our clinical practitioners and health psychologists and so on.
We're familiar with those, aren't we, Connor?
Yeah.
met one or two.
Oh, I've met you.
Yeah, and I've met you, so we're good.
So I guess it's trying to enable that team to do, to move, what was clinical pharmacy, I guess, forward into this new era of prescribing. We've got lots more medicines, lots more complex medicines that we have to give to patients, and really trying to understand how we use them appropriately, safely and effectively and so on. And I think that's what our team does, and it's about bringing them, allowing them to do that.
Mm-hmm.
And Sian kind of said at the start, but you've been fundamental in lots of the changes to the new course. I wonder if you could give us a little bit of an overview of some of the changes and some of the exciting things that are coming up in the new MPharm degree.
I've not really been instrumental in it, Connor. You're being very nice, as you were earlier on, Sian. It's the team who've done this, really. They've come up with some amazing changes. I guess just to set the scene, how long have we got?
Loads of time.
You're onto your watch there. You're getting bored already.
I'm bored already. No, I'm joking.
Just to set the scene, traditionally, I guess, pharmacy education has involved teaching some chemistry, medicinal chemistry, where you look at the molecule and how those atoms are arranged, and then how they interact with a particular receptor, how you then make those molecules, and then how you formulate them into a medicine so they can get to the site of action in a patient and get released appropriately, etc. And then you have the pharmacology, which is the study of how drugs work and adverse reactions and how you measure those things. And then you have the clinical pharmacy aspects that have been brought in, I guess, over the last 20 to 30 years. So we used to teach those things separately, and our old degree, which we're just running out at the moment, I guess the aim of that degree was to try and integrate a lot of those disciplines together, actually, to provide students with a bit of relevance to why we're teaching them. So we adopted what we've called a case-based approach, which means that we've created around, maybe 10 clinical cases, which are case histories, they're patient histories. So they give you details of the patient's age and their social history, their demographics, their background, medical history and drugs, etc. And then off of that, we get people to come in and talk about the science of those medicines and the clinical use and therapeutics, etc. So it hangs all of that, science, which can at times seem irrelevant to students. It hangs it off these clinical cases. So I think, we've had about 10 years of experience of that, course design now, and I think the feedback from students is that they really like it. It's novel. I don't know anywhere else that does or did this approach at the time in this country or even internationally. So I think it's quite a novel approach, and I think our staff like it as well, because we have a really cohesive, staff base from lots of different disciplines. So there were some really good elements of that we, as we rolled it out, there's some tweaking that needs to be done. There's some evolution of that. So when we designed the new course, it was an opportunity to try and move that forward, correct some of the things that weren't working so well. But it came at the same time as the GPHC announced these new standards for pharmacists in 2021, which was around prescribing principally. It was around multidisciplinary working, providing an education to enable our graduates to provide safe and effective care to patients, but it was also they also introduced this prescribing element. So we introduced all that at the time as well. So I guess the main changes to our degree, is that what you asked me? Sort of going off on one, something like
totally.
that. So I think the main changes are. Well, let me start with things that stayed the same, really. The case-based approach has fundamentally stayed the same. And I think what we wanted to do is have this solid knowledge base to begin with. And then I guess the philosophy of the new degree is around decision-making. So we've kept the case-based structure to deliver that knowledge, which is important for decision-making. And then we've added in a whole series of simulation exercises to help train students in some of those skills that enable them to deliver safe and effective care and prescribe.
Can I stop you, Greg?
Yeah, sure.
Just simulation exercises. What do you mean by that?
So the simulation exercises train students in skills in a safe environment. So we'll do it in the university.
Okay.
You know, in a classroom that's kitted out with a lot of the paraphernalia that replicates a clinical situation, so a GP surgery or a hospital ward or a community pharmacy. And students can then immerse themselves into that environment. And, you know, if we have actors and we have, you know, the right scenarios, they can believe that they're in this situation. They can act like they would do if they were a pharmacist. And they can make mistakes.
Okay.
And they can then learn from those mistakes. And then following that whole simulation experience, they can then move into the clinical situation where they can gain some real life experience as well.
And I think it was teach, simulate, then do. So actually you're building the confidence of those skills up to the point that they can do them with real patients confidently and safely. Yeah,
absolutely. It's around, it's the whole, the whole degree has this decision-making approach. We want our students at the end of the degree to be able to make confident, safe and effective decisions, be able to collect some information, use their knowledge and then solve problems effectively in a logical way. And the way we've adopted that is to teach them through this case-based approach, through a whole series of modules that deal with different disease areas or body systems, and then train them in these skills through the simulation, and then give them quite extensive experience across different sectors.
Brilliant. Yes, that is one. Looking at the programme, looking at the course, that's one of the major changes, isn't it, in terms of how much time students have out on placement seems to have increased dramatically. Yeah,
absolutely. And the amount of simulation time they get as well. So, we all know from our teaching, workload has gone up enormously, but from a student perspective, that will go up too. They will have a lot of time in not only being exposed to these skills, but also practicing them in this safe environment that we talked about. But then in terms of the clinical experience, it's going up, hugely. And I think we've created room in the curriculum that if we need to expand it, certainly towards the end of the degree, we can expand it even further.
Okay, I'm going to ask a weird question now that's just suddenly popped into my head. But do you think that these changes in the course reflect more the change in the profession of pharmacy, or changes in pedagogy, by which I mean like theories of teaching and learning, or is it a bit of a combination of the two? Because it is quite different. Like probably when you were doing pharmacy, this programme looks probably quite different.
Yeah. I think it's a combination of the two. Is that an easy way out?
That's a really great question.
No, but I genuinely do actually, because I think, listen, it's taken us, I remember studying at university a long time ago now, being frustrated by the lack of clinical skills teaching, because, if at the time pharmacists weren't prescribers when I was learning how to become a pharmacist. Going back even to those experiences I had on the wards with, my cricketing friends, you could see the input they had. Other people were doing the prescribing, but they were contributing to those decisions, and they were checking those decisions, they were making recommendations. But one thing they didn't do is do any physical examination. So if a patient had a rash, or they were prescribed a diuretic that wasn't having the effect, they weren't looking at their ankles to see whether they were still edematous. And I thought there's a real gap there.
Yeah.
If we had some of those skills, we could provide even better care to patients around medicine's use, not around being a doctor or a nurse, but around around ensuring medicines are used safely and effectively.
Because lots of those things that you'd be looking for would be related to the medicine. Is that what?
Yeah, absolutely. So you prescribe a medicine to treat a particular disease. You want to check that disease process is getting better, or that the patient's not suffering any harm, and you can do that partly by some physical interaction with the patient. So I think there were big barriers up when I was learning pharmacy. That wasn't our role, but I think it has some of those barriers have broken down, and we're now thinking we can do some of these things, which I think has allowed us to develop these physical assessment training that we see now. But also, the equipment that's available to us and the space that's available to us in the university has helped that as well. So we have some of these simulation mannequins and some of the videoing equipment, so we can watch students perform a simulation exercise, and we can provide feedback, and we can really interrogate their decision making and so on. So I think it's a combination of the both, probably.
Sounds terrifying from a student perspective to be interrogated in this.
Yeah, probably not the best word. Yeah, no, it's that wasn't the best word actually, because what we want to do is create an environment actually where students feel they can do anything they want effectively. They don't have to feel scared of being told off for making a mistake.
Yeah, well, and I think, we should be exploring, shouldn't we? If we are going out into practice using our skills, we should be able to have the confidence to look at ourselves and see, what have I done well, what have I done not so well.
Yeah, absolutely.
Before you can change it.
Yeah, absolutely. I mean, how else do we develop?
I don't know. Interrogate away, I say.
In a nice way.
In a nice
I don't
way,
mean, yeah.
So it's got more placement time, more skills. There's a focus on decision making. Any other key changes that you can see with this new course?
It's been developed again with a multidisciplinary, from a multidisciplinary team. So it's scientists and clinical practitioners and our stakeholders coming together to look at it from a really rounded experience. It's a really rounded experience for students. But we also have this interprofessional working element that runs through the course. So we'd already developed quite a nice. I'm not looking at you very much, Connor, because you're
it's
sort
fine.
of this way. Don't. Yeah.
No, it's fine.
He's not as nice to look at. It has been said before.
So we have.
I can't even respond to that.
You don't have to.
No.
It's okay.
We have developed on the old degree this really strong strand of interprofessional education, or IPE as they call it, which again we've further developed on this new experience, and also introduced something called a pharmacy grand round at the end of every year, which brings some of the cases together and just explores a little bit more the decision making of students, and also allows them to see other people make decisions. So we will present cases and get other experienced clinicians, scientists to look at those cases and discuss how they would approach it as well.
Sounds great.
I quite like the idea of the grand rounds. I think they're going to be really exciting for the year groups to kind of a culmination of everything they've learnt that year, and then obviously as they go through the degree of each year that they've been there, and they'll be able to see actually where they're going to in terms of people with decisions coming in. So pharmacists and clinicians coming in to make those decisions, they can see where they're aiming for. I just wanted to go back to the stakeholder thing, because actually we've had a huge input from a lot of stakeholders around Sussex. So this degree is kind of tailored to what we need of the workforce within Sussex and of the future pharmacists. So are there any things that have come out from those stakeholder meetings that kind of are really embedded into the new degree?
Yeah, so this is really important, I think, because, in my experience, we haven't really looked at the whole progression of career, or the career pathway from, I guess, day one at uni, or even before day one at university, to the whole how do you recruit students to Brighton? What is it that attracts students to Brighton? And what keeps them here in this region? What attracts them to stay here, carry on through the career pathway, maybe try different sectors, etc. And we're beginning to have those discussions, and the stakeholders have contributed to that massively. So, one of the things I think that has become apparent across different stakeholders, from primary care and secondary care, etc., and mental health trusts, is the focus on well-being, actually, because I think being a practicing pharmacist now is not like it used to be. There are lots of stresses and strains that accompany that job, and I think addressing well-being and helping with resilience, building that resilience throughout the course, and putting in, some exercises that will help build that particular skill is really important. So that's one thing that we're thinking about.
So resilience of the pharmacist.
Resilience of the pharmacist, and ensuring that they have this sort of, we pay attention to this well-being, give them tools to enable them to keep their well-being when they go into the real working world.
Yeah, and I think that it sounds like the course is well equipped to do that, in terms of you've said that your emphasis, or our emphasis now, is more on teaching skills than knowledge. And Connor and I have spoken to some other practicing pharmacists, and they've talked to us about their career path. And what's been very clear to me is it's those skills that have enabled them to navigate their profession and their career, much more than their knowledge. The knowledge is there, and you have to keep up to date with that. But it's having those good communication skills, being able to talk to people, being resilience, adaptability. Those are the things that sort of stand you aside in terms of your career, I think.
Yeah, absolutely. And, there's a huge piece of work, actually, which I probably should have mentioned earlier on, which is formed part of the degree, which is this skills framework. I don't know whether you've heard of that. You've heard of that before.
Heard of that, yeah.
Whether anyone's talked about it, maybe you'll get the principal investigator of that project on to talk in future, Stuart.
Maybe we will.
But that was a huge piece of work that began by looking at the literature to see what are the key skills that span across the pharmacy profession, and it ranges from things like numeracy skills to general science skills, through to communication and prescribing, physical examination, etc. So our students will be given this framework of these 16 skills, and at each level of the course they have a different descriptor for what we expect of that. And we'll help the students develop those skills over the 4 years of the course, and they contain things like resilience and well-being sort of built into it.
Brilliant.
So that's that itself is a really exciting development, and I think one of the important things is that students will be able to map their own development across the course, which I think is something that we haven't really had before. Even with the case-based structure, a student can't. It's not easy for a student to see how their learning in a particular area develops over the 4 years of the course. Where with this skills framework, it clearly maps across, and they can see how they have developed.
It's tangible. They can see these are the areas that I've got weakness in, and actually there is a reflection at each point at the start of the year to say, what things did I struggle to fill in my evidence matrix here? Let's work on it this year. And that's kind of be something that is a skill as lifelong learners, as pharmacists, that they're going to have for the rest of their career. So it's really nice that we're giving them feedback about how to do that at this stage as well.
Yeah, absolutely.
Brilliant. I think you've given us a very good picture of the new course. Thank you very much. It sounds exciting, sounds positive. Can you give one piece of advice that you might give to a student pharmacist?
I could do. I'm gonna roll in three.
Are you really?
Yeah, is that right? Is that right?
Wasn't the reader?
I've probably talked about these before already, but actually before that, you mentioned before about my involvement in this degree, but it's actually a team effort. So that I just wanted to emphasise that and congratulate the whole team on developing it. My bits of advice are. They are all linked together, so it is one bit of advice, but I've broken it down into three little bits, if that's all right.
We'll let you have that.
The first thing, going back to when I was, learning about pharmacy, and I think what universities used to be about, there was a lot of time and space for you to sort of enjoy the subject, and it's a great opportunity coming to university, or it used to be when we didn't have to pay fees and all those sorts of things, to just immerse yourself in the subject and be curious about it. So I think, I would advise students to just think about that as well, and just spend a bit of time, if possible, trying to enjoy the subject and the material they're learning about, thinking about those sorts of things. But it's also incumbent on us, I think, as staff, to make sure that we provide a teaching experience that gives them time and space to enjoy the subject as well.
Definitely
not take it too seriously. The other thing I mentioned already is about making mistakes, and again it comes back to enjoyment and not taking it too seriously. If you allow students to make mistakes, they can learn from it. In most other professions or hobbies or anything like that, you make mistakes and you learn from them, and that's how you progress, and we should encourage that.
Absolutely.
Of course, in our safe environment of the simulation that we're learning, but use that and allow students to do that sort of thing. And then related to that is, over the years I've seen students sort of, in these workshops and simulation experiences sort of freeze and be too scared to do anything, because they're worried about saying something that's wrong or doing something that's incorrect and getting told off. And related to the mistakes and the enjoyment, I think part of it is, just think about doing something positive, in that scenario. Have a go, do something positive, and just remember that you're a human being. The person in front of you, the patient, is a human being, and just act a bit more human. Don't worry about the marks or the feedback or getting told off. Just give it a go. So that would be my advice.
I'm going to allow that because they were all so good. Loved it. Yeah, so be curious, make mistakes, and
do something
be
positive.
Be human and do something positive. Yeah, brilliant. Love it. I'll take that.
Good.
Thank you, Greg.
Thanks.
Any more questions?
No. Thank you so much for your time to come and talk about the new degree.
No, I've really enjoyed it. You're very professional. It's like being on the Today
We're
programme.
kind of slick, aren't we?
Yeah,
We
it's
kind
very
of
good.
want to bring you back to talk a little bit more about your career progression. So we've got a whole series that we're interviewing pharmacists about how they've got to where they are.
Yeah.
And actually, I think it'd be really interesting to see how you got to where you are now, from being a pharmacist to now being the associate subject lead? Is it
I think so.
deputy subject lead of pharmacy, and obviously all the work that you're doing here at the university. It'd be really nice to see how somebody could get to where you are.
Pleasure. Yeah.
Brilliant.
Thank you very much.
We'll send you a formal invite on a horse with a carrier.
No.
Will we not? Is that not how we're doing
Possibly.
things this year?
No, I thought we said owls.
Oh, owl.
We're doing
That's a bit Harry Potter.
Yeah, we're doing Harry Potter. It worked for them. It can work for
There you
us.
go. Expect to see
So I
him
look forward to
soon.
that. I'll keep my window open.
Okay.
Do. Thank you, Greg.
Thank you.
And that brings us to the end of another captivating episode of the MUGHUB podcast. We hope you enjoyed today's discussion and took away valuable insights that will fuel your passion for pharmacy.
Remember to subscribe to our podcast and stay tuned for future episodes where we continue to explore fascinating clinical topics, introduce you to incredible individuals, and enhance your skills to bridge the gap from bench to bedside.
If you've any questions, topic suggestions, or you'd like to get involved, we'd love to hear from you. Connect with us via our social media platforms or send us an email.
Until next time, keep learning, keep exploring, and keep engaging with your studies. Thank you for joining us at the MUGHUB podcast.